This medication is a form of estrogen that is applied to the skin and then absorbed into the bloodstream. It is used by women to help reduce symptoms of menopause such as hot flashes, and certain brands may also help with vaginal symptoms like dryness, burning, and itching. These symptoms occur because the body produces less estrogen during menopause. If you are using this medication to treat symptoms in and around the vagina, you should consider using products that are applied directly inside the vagina before considering medications taken by mouth, absorbed through the skin, or injected. It is important to use this medication as directed by your doctor. Before you start using Elestrin gel in metered dose pump, make sure to read the patient information leaflet from your pharmacist. Also, be sure to learn how to properly use the pump and apply the gel. If you have any questions, don't hesitate to ask your doctor or pharmacist. When using the pump for the first time, make sure to follow the instructions for priming it. Use the medication exactly as directed by your doctor. Apply it to clean, dry skin on the upper arm/shoulder area, usually once daily. Avoid applying the medication to broken, irritated skin, and do not apply it to the breast, face, or in or around the vagina. The dosage is based on your medical condition and response to treatment. Do not increase your dose or use this medication more often than prescribed. After applying the medication, wash your hands thoroughly with soap and water. It's important to wait about 5 minutes for the application site to dry completely before dressing and wait at least 1 to 2 hours before allowing others to touch the skin where the medication was applied. To get the best effect, wait at least 2 hours before showering or swimming to allow the drug to be absorbed through the skin. Use this medication regularly at the same time each day to get the most benefit from it. Avoid getting the medication in your eyes, and rinse them with warm water if it happens. Let the gel dry before smoking or going near an open flame. Keep track of the number of doses used and discard the pump after all the doses are used, even if there is some gel left in the pump. Lastly, tell your doctor if your condition does not improve or if it worsens. Some common side effects of Elestrin gel in metered dose pump may include nausea/vomiting, bloating, breast tenderness, headache, or weight changes. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist as soon as possible. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits to you outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, it's important to notify your doctor immediately if you experience any serious side effects, such as persistent nausea/vomiting, mental/mood changes, unusual vaginal bleeding, severe abdominal pain, or swelling in the hands/ankles/feet. This medication may also rarely cause serious issues related to blood clots, so it's important to seek medical help right away if you experience symptoms such as chest pain, sudden/severe headache, or trouble breathing. While a serious allergic reaction to this product is rare, it's important to seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not listed here, be sure to contact your doctor or pharmacist. If you're in the US, you can also report any side effects to the FDA, and in Canada, you can report them to Health Canada. Estrogens, whether used alone or with another hormone, have rarely caused very serious side effects. It's important to discuss the risks and benefits of hormone treatment with your doctor. Estrogens should not be used to prevent heart disease or dementia. Estrogens can increase the risk of cancer of the uterus. Taking a progestin as directed by your doctor can help decrease this risk. It's important to tell your doctor right away if you have any unusual vaginal bleeding. In postmenopausal women, estrogens, taken with or without a progestin, increase the risk of cancer of the breast/ovaries, stroke, dementia, and serious blood clots. When used along with a progestin, estrogens also increase the risk of heart disease. The risk for serious side effects may depend on the dose of estrogen and the length of time it is used. This medication should be used at the lowest effective dose and for the shortest amount of time. It's important to discuss the use of this medication with your doctor regularly to see if you still need to use it. If you will be taking this medication long-term, you should have regular complete physical exams as directed by your doctor. Before using Elestrin gel in the metered dose pump, it's important to discuss any allergies you may have with your doctor or pharmacist. This product may contain inactive ingredients that could cause allergic reactions or other issues, so be sure to talk to your pharmacist for more details. You should also inform your doctor or pharmacist about your medical history before using this medication, especially if you have a history of certain cancers, blood clots, heart disease, liver or kidney disease, high blood pressure, diabetes, or other conditions. Also, it's important to avoid smoking or using tobacco while using this medication, as it can further increase certain health risks. If you have recently had surgery, or will be confined to a chair or bed for a long time, be sure to inform your doctor, as these conditions can increase your risk of getting blood clots while using this medication. It's also important to be aware that this medication may cause dark areas on your face and skin when exposed to sunlight, so limit your time in the sun and avoid tanning booths and sun lamps. If you are nearsighted or wear contact lenses, you may also experience vision problems, so be sure to contact your eye doctor if you have any difficulties. Finally, it's important to keep this medication away from children, as it is not meant for use by children and may cause unwanted side effects if they come into contact with it. Additionally, Elestrin gel in the metered dose pump should not be used during pregnancy, and if you are breastfeeding, it's important to consult your doctor before continuing to do so. It's important to be aware of potential drug interactions with Elestrin gel in metered dose pump. Some products that may interact with this drug include aromatase inhibitors, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. This medication may also interfere with certain lab tests, so it's important to inform lab personnel and doctors that you are using this drug. Always keep a list of all the products you use and share it with your doctor and pharmacist to ensure the safe and effective use of this medication. Remember to never start, stop, or change the dosage of any medicines without your doctor's approval. If someone accidentally swallows Elestrin gel in a metered dose pump, it can be harmful. If they have serious symptoms like passing out or difficulty breathing, it's important to call 911 or the local poison control center right away. Symptoms of overdose can include severe nausea and vomiting, as well as unusual vaginal bleeding. It's important to keep this medication out of reach of children and pets. Always store it in a safe place and dispose of it properly if not needed. Remember to use Elestrin gel in a metered dose pump exactly as prescribed by your doctor for the best results. It's important to remember not to share this medication with others. While using Elestrin gel in metered dose pump, it's essential to have regular complete physical exams and medical tests, such as blood pressure, breast exam, pelvic exam, and pap smear. Your doctor will give you specific instructions for examining your breasts, and it's important to report any lumps right away. Be sure to keep all your medical and lab appointments. Taking steps to prevent or control high blood pressure, high cholesterol, and diabetes can help reduce your chances of heart disease and stroke. Lifestyle changes such as reducing stress, eating a low-fat, low-salt diet, losing weight, exercising regularly, and quitting smoking can make a big difference. Staying mentally active with activities like reading and solving crossword puzzles can help prevent dementia. Talk to your doctor about lifestyle changes that might benefit you. If you're dealing with hot flashes, making some lifestyle changes can help. Consider quitting smoking, dressing lightly or in layers, avoiding certain foods like spicy foods, caffeine, and alcohol, reducing stress, and exercising regularly. These changes may help reduce the frequency and severity of hot flashes. If you forget to use a dose of Elestrin gel in metered dose pump, use it as soon as you remember. If it's close to the time for your next dose, within 12 hours, then skip the missed dose and continue with your regular dosing schedule. Don't take a double dose to make up for the missed one. It's important to store Elestrin gel in metered dose pump at room temperature, away from heat and open flames. Make sure to keep it out of reach of children and pets. When you no longer need it or it has expired, be sure to properly discard it according to the instructions of your pharmacist or local waste disposal company. Remember not to flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.